what other data did you gather about this particular case? Because especially when I think about using technology to look at things like case studies and clinical trials and stuff like that, and thinking about the fact that there's so many elements that we don't know that kind of impact how diseases present. Um, when we look at these cases, are you thinking maybe more expansively about what other data that we maybe can collect, and what data did you end up collecting around the case?
So, like all these three pheochromocytoma case, I was thinking like the data's like how the patient present. Usually, we do not go to the doctors if unless we have some debilitating symptom that is affecting our quality of life. So I think these cases get delayed diagnosis or already the damage has been done to their heart or kidneys, and that's some point they present. I feel like we should find out the symptoms earlier in the disease process where we can take the necessary step and prevent the complication in terms of cardiovascular and the renal complication. Those are two vital organs for a human.
Mm. Are there any comorbidities that tend to pop up with this that maybe could be a signal?
Yes. So the pheochromocytoma, if we don't get diagnosed them on the right point, if it damage happens to the renal function and the cardiovascular dysfunction, so you are like already have the complication. Rather, when you remove the tumor, you have already the comorbidities, like you already have done enough. You cannot reverse those complications. So it's very important to catch them early to prevent the complication, which can increase the survival of the patient.
Mhm. Are there any lifestyle, genetic, or any exposure factors that kind of increase the likelihood of this diagnosis?
So it was like definitely it has the genetic thing. So whoever is diagnosed with pheochromocytoma, we ask them to the offspring, the family members should get the genetic counseling and the testing. So that makes a huge difference, I would say, because if he wouldn't present, we would know that he has the disease. He will have the complication down the years, and his offspring will also not get like diagnosed or screened for the genetic syndrome.
Mm. So it's definitely like a for sure manifestation of that disease through the parents or through the bloodline or what.
This is one of them because there are multiple reasons. This is one of the reasons, the genetic, but could be other reasons, multifactorial. It's not only
Mm,
in the family or like genetic, I would say, but there are others.
mm,
The studies, there are not enough data to tell us exactly what is the reasons.
mm.